Assalamu alaikum. Examination of the abdomen. Abdomen is divided into 9 anatomical regions. The upper region has right hypochondrium, epigastric region, and left hypochondrium. The middle region has right lumbar, umbilical region, and left lumbar region. The lower region has right iliac fossa, hypogastric region, and left iliac fossa. Clinical examination of the abdomen should always include inspection, palpation, percussion, and auscultation. The first step is to introduce yourself and take consent. The ideal exposure is from nipple to the mid-thigh. Abdominal examination begins with inspection by standing at the foot end. Look for scars, asymmetry, distension, dilated veins, and visible peristalsis. Ask patient to cuff and look for any bulge. This is called cuff impulse. Then check for Carnot sign. Raise both lower limbs of the patient and observe the bulge. Cuff impulse and Carnot signs are performed for hernia examination. After inspection, palpate all 9 areas, first superficially and then deeply, starting away from the painful area. Lightly palpate each of the 9 abdominal regions, assessing for any pathology. In deep palpation, ask patient to take deep breath and press your hands during expiration and keep steady during inspiration. If any masses are identified, assess its size and shape, location, and consistency. Visceral palpation is done to palpate liver, spleen, and kidney. In liver palpation, keep your right hand transversely in right iliac fossa. Ask patient to take deep breath and slowly slide your finger towards the right rib cage. When lower edge is felt, its consistency, surface texture, and size can be evaluated. For spleen palpation, start palpating from right iliac fossa and move diagonally to left hypochondrium. If palpable, note its size, surface, and consistency. To feel kidney, place the right hand anteriorly in the right lumbar region and left hand posteriorly in the right loin and palpate deeply. Repeat this process on the opposite side to palpate the left kidney. Assessing percussion sounds is helpful in determination of size, position, and density of the abdominal contents. For liver, start percussing from right iliac fossa towards the right costal margin until percussion note changes from resonant to dull, indicating lower liver border. Continue to percuss until note changes from dull to resonant, indicating upper liver border. For spleen, start percussing from right iliac fossa towards the left costal margin until percussion note changes from resonant to dull, indicating the location of spleen. In absence of splenomegaly, the spleen should not be identified using percussion. Fluid thrill and shifting dullness are reliable signs for the determination of the SITs. In fluid thrill, ask an assistant to place a hand firmly on the center of the abdomen. Flick one side of the abdominal wall. Feel for the transmitted pulsations with the other hand, which is placed on the opposite side of the abdomen. In shifting dullness, percuss from umbilical region to the patient's left flank. If dullness is noted, this may suggest the presence of ascitic fluid. Patient is then asked to lean on lateral side. Wait for 30 seconds for any fluid to shift. If ascites is present, the area that was previously dull should now be resonant. In the last, auscultation is done. Auscultate over at least 2 positions on the abdomen to assess bowel sounds. If no gut sounds are audible for 1 minute, then label as gut sound absent. Thanks for watching.